That's how it should be. And we're getting better and better in every field, but it's especially exciting with spine because we figured it out. It's clear now, it's obvious. If you come to me in pain, I'll tell you exactly why each of your elements of pain is there. I'll tell you how you can fix it. If I do a good job, you should be able to go to the gym right away. You should be able to get back to your normal life. I mean, most of my patients don't need therapy after surgery because I don't really traumatize them. So it's like an electrical thing. I feel like an electrician sometimes. I sneak in, correct the problem, and sneak out.
I have to tell you, I've worked with physicians my entire life, and some of my best friends are surgeons. I got to tell you, you have your personality and your just whole way of being is so refreshing to me. Oh, like of all people that should have a giant inflated ego, I would go, you can have one, and I would be okay with it. I mean, I accept my other friends' big egos, but you're so down to earth and just a real human being that like I said, you could have a God complex, and I don't see it. I really, really appreciate your authentic nature. You have amazing wit and humor. You belong on TV. I know that your patients would miss you, but you really do belong on TV too.
Thank you. I appreciate you. You're so kind. Thank you, Joshua.
I've really enjoyed this. I really have. Anyway, listen, I would love to give you the final word. Please plug and promote anything you want to promote, but also if there's something that is on your heart to share that maybe you didn't get to share through the answers in the question and answer section, please share it. The floor is yours.
All right, I got two things. First, we touched this, which is stem cells. Okay, so stem cells are a bunch of babies. And Josh, if I take a 2-year-old or even a 1-year-old baby and I sit them next to you for a couple of months, I promise you they're not going to become a great podcaster like yourself. Babies need to be raised and stem cells need to be guided. And the multi-billion-dollar stem cell industry is based on a fairy tale. Okay, whether you take those stem cells out of the freezer, out of the umbilical cord, out of your fat, or out of the bone marrow where they actually are, the viability, meaning how many of the cells are actually alive by the time you put them into the knee or the hip joint, is very low. And whatever you put in there, your body is going to destroy it. Floating around in a sea of joint fluid does not make your stem cells become cartilage. It's wishful thinking. The thing is this, in my world, the world of musculoskeletal pains, most things get better on their own. So a placebo treatment in my world has a 75% efficacy, not 50-50. So if you do something ridiculous for 72 sessions, there's a 75% chance you're gonna get better. And then you're gonna come back and say, it was those $30,000 stem cells I had in Mexico. That's why I'm better. There's a huge retrospective fallacy, retrospective bias that we're all subject to. So if you're thinking stem cells and someone's pushing you to do stem cells, I'm begging you, get a second opinion. Second thing I really want to start is this thing with testosterone. So in med school, I remember very clearly learning about not messing with your pituitary, thyroid, adrenal axis. All your hormones are interconnected. They start in the brain makes other brain chemicals show up. Those make stuff in the thyroid or parathyroid grow. That makes stuff in the adrenal gland grow. That makes the stuff in the testicles grow. It's all connected. If you start replacing one, you affect all of them. And in a way, which is very scientifically sort of known, which is this negative feedback loop.